Welcome to all our alumni, healthcare professionals, and students. We have 1,800 registrants today. And thank you especially to McCombs alumni and all the Texas Exes in attendance. This is our 9th annual collaboration between McCombs and the Federal Reserve Bank of Dallas. And we gather together and interview top economists and business executives from key industry sectors that influence the Texas economy. My name is Lillian Mills. I'm the interim dean at the McCombs School of Business here at the University of Texas at Austin. All of the questions were pre-submitted, so we're not collecting extra ones live. Now, between me and the three panelists, we have 4 doctors here, but the only medical doctor is our colleague, Dr. Mark Boom. He is president and CEO of Houston Methodist, is assistant professor at Cornell University and an adjunct professor in the University of Texas School of Public Health. We also welcome Dr. Pia Arrhenius. She's a labor economist working on regional economic growth and demographic change, and manages the regional and microeconomics group at the Dallas Fed in their research department. She's also the executive editor of the quarterly Southwest Economy publications. And then my professor colleague, Indranil Bardhan, is the Foster Parker Centennial Professor of Management in the McCombs School at UT Austin. His research focuses on healthcare analytics, the impact of information technology, and I appreciate his close collaboration with UT Southwestern Medical and UT's Dell Medical School. And he teaches in our new Master of Science Healthcare Transformation program. We've graduated our first cohort of 45 students and the second one's underway. It's a joint grad program between Dell Med and McCombs, where health professionals lead value-based transformations. So, we're going to start talking about the COVID pandemic. This sent, big personal economic shockwaves around the world. More than 2 million people died globally, and that includes 34,000 people in the state of Texas, and lots of people have lost their jobs. Hospitalizations surged this winter with constrained ICU beds and opening of field hospitals. So let's start with the pandemic's economic impact in 2020, those disruptive and societal impacts, and then your expectations for healthcare industry into the future. And Pia, if it's okay, I'm going to start with you. You've been an economist for a lot of years at the Dallas Fed. The 2020 economic collapse is going to go down in the record books and be your comparison going forward. What can you tell us about big effects from the pandemic in the Texas economy, and what's your medium-term outlook?
Thank you, Dean Mills. It's a pleasure to be here today. So the pandemic caused a recession like no other recession we've experienced. And of course, I would also say it generated a fiscal and monetary policy response like none other either, but we can come back to that later. Initially, my colleagues and I thought the pandemic was more like getting hit by a hurricane than a typical recession. And we generally expected a V-shaped impact on employment and activity, which would have meant a very quick bounce back, this past year. Like if you think of Houston, for example, after Hurricane Harvey, within a few months, employment was back to where it had been before the hurricane. But we should probably have listened to the epidemiologists because this is not what happened. Yes, there was a severe decline in activity and employment in all industries and across all geographies. And we initially lost over 11% of our employment in the state. And that was over 1.4 million jobs. So just a huge impact. But then the recovery has been slower than we hoped. And I think, big reason is the resurgence of the virus, both in July and also at the end of the year and what we're experiencing currently. So to date, only a little over half of the jobs lost have been added back. We're down about 4.5% from where we were 1 year ago in terms of employment. So we really still have a ways to go. With regard to the outlook, now that the vaccine is here, our outlook for the medium term is pretty positive. The Dallas Fed has forecasted over 4% job growth this year, which is way above our trend rate of growth. But we still expect a slow first quarter, but then things to really pick up after that. And in our business outlook surveys, which survey over 600 firms every month in Texas, most of them expect to be back to normal by the end of this year.
Okay, so in terms of when the state of Texas is going to recoup the jobs it lost, you're thinking still in this calendar year, maybe. Which sectors are going to outperform? Which ones are going to be lagging even in 2021?
Yeah, so even with the rapid job growth that we're predicting for this year of, as I said, over 4%, we will not recover all lost jobs by the end of this calendar year. In fact, we may be halfway through 2022 before we are back to where we started.
Okay.
In terms of the sector impact, as you can imagine, the largest negative effects are on the face-to-face industries in the service sector, like hospitality and leisure, so restaurants and hotels, any arts and recreation venues, anything related to traveling, passenger airlines, cruises, tourism, that type of thing. Of course, another problem for us in Texas has been the impact on the oil and gas sector, which has just been decimated. So they lost a quarter of jobs last year with the plunging oil prices and plunging production in the energy sector, just because there was such a drop off in demand for gasoline and jet fuel and so forth. Of course, on the other hand, some industries have been booming. So as the service sector has faltered, the goods sector has surged. So things like construction have been doing quite well. Manufacturing has hung in there. Residential construction has been just off the charts. Home sales have surged. In fact, we saw a 6 percentage point increase in Texas in the home ownership rate last year, which is just unprecedented. So it's a little bit a tale of two cities with regard to the sectoral impact of the pandemic.
So Mark, let's talk about the economy, but we'll move it to healthcare, where you're stewarding a huge hospital. Seems like the healthcare sector has lost jobs. Why would that be true in a pandemic? And does it permanently restructure healthcare employment in some way?
Yeah, I think there's a couple things to keep in mind. First is healthcare is a huge sector across Texas, across the United States. It's very diverse. So you're talking the full array from large, sophisticated institutions to very much mom and pop kinds of shops, small employment of a few people. It's very fragmented still in the United States and certainly in Texas. As a result, the impact's been felt very differently across different parts of the sector. I will talk about us for a second. I mean, we didn't do any layoffs. We didn't do any job cuts. We didn't do any furloughs. So when you look at those economic numbers, you at the surface say, okay, a big hospital system like Houston Methodist didn't actually contribute to that loss of jobs overall. But if I look at our numbers, we grew far more slowly this year as we dealt with the impacts of the pandemic. So we're a place that normally would have been adding jobs. So when you look at that aggregate, there's a whole bunch of diverse and kind of adding on kinds of things. Healthcare has this sort of reputation as being recession proof. It is not recession proof. It is recession resistant. In other words, when oil and gas goes like this, we go, like that at a smaller level, but we still feel it. Every time, for example, oil and gas has been hit in Houston, we feel that impact in healthcare. This spring was absolutely brutal for most healthcare institutions because the craziness of how healthcare is funded is there's so much cross-subsidization and so much happens from the kind of elective side of things to pay for the non-elective side of things. And when you shut that down, it really turned healthcare on its head for a couple of months. That has recovered and you'll see that job growth coming back. Certainly right now, we can't hire fast enough for the clinical people that we need, but still the administrative side, everybody's being really cautious given the challenges. And so on aggregate, it's still slower growth.
Let's narrow in a little further on the Affordable Care Act, because one option was to take federal money to expand Medicaid coverage, and the state of Texas chose not to. What effect do you think that had to access to health care during 2020 and continuing into 21?
Yeah, I mean, there's no question we have seen a very unequal sort of response and an unequal impact of COVID. So COVID in one way is, you know, the great leveler, right? Anybody can get it. You've seen President Trump, you've seen Boris Johnson and others. So really can affect any human on the planet. But at the same time, it really exposed a lot of inequities in our health systems. And we saw communities that were lower socioeconomic status, higher people in poverty, you know, deserts in terms of food access, in terms of pharmacy access, in terms of healthcare coverage, really be impacted in very disproportionate ways. So when you look at the question about Medicaid expansion, Texas is one of the states that has decided not to do that. One of the results of that is we have 18% uninsured. That's double the national rate of 9%. 39 states have now actually expanded Medicaid and have actually addressed that. If you look back at the last few elections, 20 states were Republican, so they're red 4 times in the last elections for president. 4 states were 3 times, 3 states were 2 times. So what you're seeing is many red states have figured this out. We're a red state that hasn't. So really there's an ability to do this. I think it requires bipartisan action. I think, you know, if Biden's serious about unity and about bipartisanship, I mean, I think that administration working with a Texas administration with others really needs to ask the question of how do we close these gaps? How do we all determine, you know, at the end of the day that 18% uninsured is completely unacceptable and is going to continue to have these issues. And then the final thing to acknowledge is that we're going to see those numbers get much worse. I mean, we heard about the job numbers overall. Right now, we haven't seen that because people still have COBRA coverage by and large, but that's going to start flowing through the economy here unless people are rehired at a rapid rate into employer-sponsored healthcare. So it's a real significant issue for us. Thanks,
Mark. Indy, let's partition a little bit. Which sectors within healthcare do you think are going to have the longest term consequences of COVID-19?
Thank you, Dean Mills, and thank you for having me on the panel. One of the things that we've observed the last about 5-6 years of data, healthcare industry as a whole has grown at a rate of about 4.7, 4.8% in that range prior to COVID. When COVID came along in March of 2020, the entire sector was hit. Hospital spending, for instance, was down about 36% just in March and April of 2020 alone. So I look at the data for the first 10 months of 2020, overall, the data shows that some sectors got really badly hit. For instance, physician and clinical services was down about 3.1% for the first 10 months of 2020 compared to the previous year. And hospital care and related services was down about 3.6%. The 2 sectors that have actually held steady and have actually improved over time, and which we expect to do even better over time, especially 2021 and beyond, are home health care, which actually grew about 14% last year and is expected to grow at the same rate, if not more, this year. Prescription drugs was about the same, about roughly a 3% growth, but home health care is where a lot of the action is. And this is actually borne out by the data on digital health investments, which shows that the 2 biggest areas of growth in terms of VC funding and other investments is telehealth and remote patient monitoring. And both of those types of investments are actually driving the increase in home health care. Telehealth, for instance, grew from before the pandemic and only accounted for about between 1% and 2% of all physician visits. And today it's about roughly 7% of all physician visits. So it's grown by a significant factor. So in the near term future, at least for 2021 and 2022, we do expect a much more of an evolution from a typical face-to-face model of patient care in the healthcare industry to a hybrid model where you're going to have some face-to-face care, but also complemented by at-home care driven by these technologies. So that's where I would expect the growth in the industry to be.
Thanks, Indy. And I know that that's in combination with so many medical devices that can be used. I've got a relative with a diabetic underskin monitor, and So it's not just the telehealth, it's that we've got personal devices that help facilitate the telehealth. Yeah, so an open question to any of you, if you want to answer, do you have in mind some policy initiatives that the Biden administration could implement or that you wish they would implement to alleviate some of the impacts? I know, Mark, you talked about we need more bipartisan conversations, but I thought I'd throw this open to anybody that had other ideas.
I guess on economic policy, I can just start us off. I guess, well, the big discussion is currently about additional stimulus, which would certainly bring the economy back sooner and faster. I guess with the current pace of vaccinations and the improvement that is already forecast for the economy without this additional stimulus, there's some concern that a large stimulus program would actually overheat the economy because of the timing and the size of it. Some economists have proposed adding triggers to the stimulus, which means resources would only be released if certain economic conditions were met. And so that's a good idea. I'm not sure if that's getting consideration by the current administration. Of course, there are other provisions that are on the table that would hurt and slow our recovery, especially in Texas. Something like a very large increase to the minimum wage would probably slow our jobs recovery here in this state. And of course, I would be remiss not to mention, there's a lot of discussion around the regulation of oil and gas, but we've looked at it, and even with these additional regulations currently, we don't think it would have a big impact on our oil and gas industry, but maybe in places like New Mexico, our neighboring state, where they have a lot of drilling on federal land.
Yeah.
So one of the other areas that I think I would like to just mention in terms of policy initiatives that the Biden administration can implement to alleviate some of the impacts of COVID are continue with what they call the 1135 waiver for telehealth, which actually prior to the COVID pandemic, you could only get telehealth reimbursement for very, very specific types of visits. And it was primarily aimed at the rural market. But today it's available practically for most types of physician visits. So to continue with that waiver and expand reimbursement to incentivize virtual care, I think would be a very important initiative for the new administration. And also, just because you have telehealth doesn't mean that you've solved the issue of disparities and in terms of access to underserved populations. So disparities in terms of health equity. I think more needs to be done in that area to address some of the problems where senior citizens and people who are not, who don't have access easily to, digital means to access telehealth, that needs to be addressed. And the last item that I would mention is the ability to expand virtual healthcare across state lines. I think that would also be an important factor, that the administration can consider.
Yeah, gosh, thanks. You're right. We have some really big city centers that are near a state border. I think of you, Mark, in the Houston area. You're pretty close to Louisiana, and there could be some rural West Louisiana people that would like to have telehealth appointments with with your hospital or MD Anderson.
No question. I completely agree with all of that. This state border issue has been a real obstacle during COVID in many ways. And so we need to figure that out as a health profession and licensure side of things.
I just wanted to add one thing that the Biden administration has already done, which is actually beneficial, is they're planning to open up the ACA exchanges again for people to sign up for health insurance. So that's actually very important because, as Dr. Boom was saying, COBRA coverage is going to run out for unemployed workers. And so if they can go on the exchanges and sign up for health insurance, that's really a big positive.
Yeah. Okay, well, let's turn to innovation. And I'm going to go back to you, Mark. What sort of innovations came out of the pandemic that might not have even gained traction without it? And I expect telehealth is one of those, but take that one and go elsewhere with it if you want.
Honestly, I think I could talk for an hour on this topic, so I'll try to keep brief, because really the pandemic, one of the silver linings of this pandemic is it really injected steroids into kind of the process, particularly around the digital innovation in healthcare, especially virtual care. I'd say we probably, as a industry, probably evolved 5 years in about 2 months. Many of the things that we were expecting to roll out, we've been prepping to roll out, but we recognize, you've got to kind of teach a lot of old dogs new tricks, and you've got to bring your clinicians along and everybody else. Really happened almost overnight, and that's going to be, I think, one of the good things that happened in this pandemic. So let me give you a couple of examples. We were working on something called virtual ICU. So this is where we can essentially have a central command center that oversees every one of our ICU patients' ICU beds with a trained physician with all the data there. So it's not replacing the frontline people, it's an enhancement to that. So it brings better quality to the bedside, more rapid response, et cetera. Imagine during a pandemic where you can't walk into a patient's room safely, or if you do, it's a lengthy process, donning and doffing and everything else that you have to do with personal protective equipment. That has been huge, and we literally were going to roll that out over the course of the year and turned it on, and it's applied to 330 ICU beds over the course of about 3-4 weeks. And now with 9-10 months under our belt, this will never change. It's a huge impact. Many personal touch items. We have iPads, and we were rolling iPads in every single one of the rooms as a device for our patients. That's in almost every room now, as a communication tool, an entertainment tool, now Alexa. And so we've got Alexa in, about half of our patient rooms already. And you can say, hey, Alexa, I need to talk to my nurse, and all those kinds of things have really been propelled forward very dramatically. And I'm just scratching the surface of things we've done, but I think that's going to be a real positive going forward.
Boy, that's great. And it sounds like you were ready for it right when it came. So you had been making those investments in advance. I've got to believe you were way ahead, miles ahead of some rural hospitals that weren't planning for that transition.
Yeah, one of my favorite quotes is from Louis Pasteur, which is "Chance favors the prepared mind," and it's kind of a perfect quote because this is a guy who helped found germ theory, and back in his day was telling all the doctors to wash their hands when they wouldn't wash their hands, and did a lot of early vaccine work. So he's kind of the perfect quote for that. And never has that been more true than during this pandemic. So we had a Center for Innovation. We had virtual urgent care in place. And so, virtual urgent care is an example. We had about 70 of our physicians who had kind of run towards that and were doing that and active in that. Now we have 600 to 700 just in our employed base, let alone what all the private physicians did who do that. We were doing 3,000 visits a day at one point. And if I go back a year and a half ago, we would do a couple percent of our visits. Now 30% of our visits at a baseline, even when we're not in surge, seem to be virtual. And so those kinds of things will sustain. But really very critically, having that preparation. To talk about rural very quickly, I think this is actually one of the solution points for some of the challenges of rural health. And so we're going to be partnering very actively with rural hospitals, because think of what that enables to happen in a small community. Somebody doesn't have to drive 200 miles to see the specialist that they might have seen otherwise. Something like virtual ICU, you can put, a massive infrastructure behind a very small ICU in a small town someplace and really enhance the quality of care. So I think it's going to have tremendously positive ramifications going forward for the healthcare of everybody, but certainly in rural communities.
Yeah. And Indy, pick it up from Mark and tell us some more about technology-enabled solutions that are helping this response.
No, thank you. Thank you so much. And I think just piggybacking on what Mark said, I agree completely. I think one of the positive impacts of what has happened, due to the pandemic is this enhanced notion of systemness, where you have greater collaboration between health systems to facilitate care for patients, including between academic medical centers and community hospitals, exactly to Mark's point. In terms of technology, I have some numbers here, thanks to my friend, local venture capitalist in Austin, Emma Cartmel of Cartmel Ventures. Some of her data points to the fact that VC funding in digital health has increased by about 350% over the last 5 years. And just in 2020 alone, the first 6 months of 2020 saw about 6.3 billion in digital health investments, out of which about 2/3 were going towards consumer-centric companies. Instead of hospital and practice-centric companies, these were going towards consumer-centric. And most of that investment has been in things like telehealth, about $2 billion, $800 million in mHealth type companies, mobile health, clinical decision support, as well as about $400 million towards companies that are improving wearable sensors for remote patient monitoring. So one of the other things that has also happened, and there's been some research that has shown this, that has shown some initial evidence that one of the things that technology has helped to enable is a fresh look at these new types of payment models for value-based care. So our Value Institute at the Dell Medical School actually is one of the leaders and pioneers in that area in terms of implementing new types of payment models like bundled payments with respect to some of their integrated practice units. Some of the research has shown that the pandemic has had far less of a negative impact on the revenues of health systems that have already implemented capitated or global payment structures. The last thing that I would like to mention in terms of technology is that many companies, for many hospitals and health systems, they've increasingly used artificial intelligence, AI and analytics to improve everything from their supply chains to better and more accurate diagnosis of COVID-19 patients, for instance, right? To accurately manage and forecast patient volume and PPE, and also to optimize their resource staffing, their clinical staffing. And so, again, there's been a significant increase in the use of some of these new types of emerging technologies, including AI and digital health investments in healthcare.
Thanks, Indy. And Pia, I'm going to turn to you from the perspective of your role at the Fed. What investments in digital health have you been seeing from your vantage point, and what's the long-term impact of those going to be?
So I'll speak more broadly to what we're seeing across all industries, not just in healthcare, because I think Dr. Boom and Dr. Barden really went into great detail about the healthcare sector. But we're generally seeing, as a result of the pandemic, a very rapid speeding up of technological innovation and technological adoption in all firms, really across industries. And so what we're hoping comes from this is productivity increases, in years to come as as this as technology really makes us more efficient and able to produce more and get better outcomes with fewer resources. So hopefully that is coming in the future, which will boost growth, relative to where it would have been. With that comes a challenge, and it's to the extent that technology is changing the way we do business and how we deliver care, and to the extent in which it's displacing workers. So when technology comes into a firm and affects operations, we may need to reconfigure, the head count and who does what in a business. And when that happens, to the extent that people are displaced or laid off or have to, go back to for more workforce training and so forth, we need to make sure that the resources are there for workers to retrain, for workers to move across businesses or even across industries, even change occupations in response to changes in technology. I think that's the broader implication and long-run implication of what's going on.
So I've been watching that there is a little bit of Q&A showing up in the chat. And I'll remind you that we had 1,800 registrants. We took a bunch of questions in advance of this webinar, crafted them in the best order we could. And so I'm pitching to you questions that all of you submitted earlier, but we're probably not going to be able to get to these live during this webinar. But a number of them do relate that I've been seeing about societal impact, and we'll turn to that in just a few minutes. So to wrap up in this economic conversation and open to any of you, if there's more you wanted to say about the innovations that will still be affecting us 5 years down the road, what's your forecast? And again, it's, you know, the silver linings that are going to persist in the healthcare industry.
I'll pick up a couple very quick thoughts. You know, one is this has shown everybody what's possible, and that it's possible, and it's possible to do it quickly. So that's going to be also one of the very big silver linings. So many of the things that would have taken a long time to implement are getting implemented quickly, and we need to hold on to those gains and bake that into an innovation culture. That's been a big part of how we've tried to structure our culture. But even there, you know, this is that on steroids. And so I think that is a big thing going forward. When you think about healthcare innovation, a lot of things we were both talking about, you know, there's kind of a last mile. You know, I think about some of the struggles sometimes of an Amazon or others. There's still that last mile problem for digital health. And a lot of that is then, how do you get the physical exam conducted? How do you get the vital signs you need? How do you listen to somebody's heart? How do you actually figure out to palpate their abdomen? You know, there's a lot that could be done if we can figure some of those last mile issues out. And so a lot of wearable technologies, a lot of monitoring solutions, and a lot of those give us that ability to care for people longitudinally. And I think the opportunity for physicians and hospital systems, probably as opposed to the Silicon Valley, is how to take those issues and those opportunities and turn them into lifelong relationships, so you can help manage somebody's care, manage, frankly, somebody's health much better than we manage, as opposed to just responding to their problems that they have. And so I think there's great opportunity, and we've been seeing the way, but that's still one of the tough problems, is how do you get that last mile solution? How do you get into the patient's home or the individual's home and monitor and diagnose what you need?
Well, you were talking early on, Mark, about old dogs and new tricks, and it occurs to me there's this huge spillover that if a generation of people who did all their banking in person with the teller, all their shopping in person at the store, all their doctoring in person at the doctor, learned to shop on Amazon or Walmart Plus, learned to deposit checks online, the spillover to how do I trust the online telehealth, it's all reinforcing that it's really a, do I trust the technology with all these aspects of my life? And yeah, I think those are going to have a long-term effect.
Well, and we're seeing that people do trust them, to your point. I mean, this is we are a society that's been preconditioned to figure out how to trust those online. This was the year where if there was any doubt about that, it's gone. Right. People do trust that.
Yeah. Well, let's talk some about societal health around healthcare. And gosh, Pia, we've hinted at the idea that some people have been displaced or disproportionately affected. Do you see policies that the new federal administration is intending to, or could, or should implement to help the people most affected by COVID-19?
I think in general, they have a good ear in this current administration in terms of listening to people's, people have been heavily impacted and harmed by this pandemic. Although I think a lot of the policies that we need to help people along have already been put in place. And so again, we talked earlier about additional stimulus, but things around unemployment benefits are very important. That unemployment benefits, continue in some form, even for people that are now long-term unemployed as opposed to short-term unemployed, which is what, we started out with people being short-term unemployed, but now that's sort of transitioning into longer spells of unemployment, which is a problem. Stimulus payments came through, and I think they were very effective. We saw that consumption was really sustained, especially among low-income households, as a result of the generous stimulus that came across last year in the CARES Act. Now, there were certain categories of people left out of that that now has been remedied. For example, immigrants, certain immigrants, like undocumented immigrants, which we have a lot in Texas, we have probably 1.5 million or so. And so that stimulus has now been extended to them as well in the last round of the stimulus program. So that's helpful for them, those families, and also for the state. And I think from a pandemic perspective and a public health perspective, it makes sense that you sort of need to corral everybody, under one umbrella to prevent sort of further spread and misery as a result of the pandemic. And then there's things that we mentioned earlier, like workforce training, for the long-term unemployed, transitioning them back as the economy comes back. But then there's other things that have also been a real barrier for certain people that have been hurt by the pandemic, and things like childcare. School closures have been a real problem. Women have been very hurt by this pandemic recession, mostly because of problems with sending kids to school and closed childcare and so forth. And then there's the additional issue of transportation. Transportation is sort of a long-standing issue in terms of how do we get people to the jobs that they can apply for and get hired at. So those are some issues that need to be looked into.
Thanks, Pia. I'd like to move to vaccinations and start with Indy and then flip over to Mark. So Indy, we're in the middle of rolling out vaccines. There are new shipments every week. What do you think about what we're learning about distribution mechanisms, and what role is technology playing in figuring out where to send them or how to prioritize them? I know we're in the middle of a huge experiment with every state's doing it a little bit different. So there will be research to come with a lot of semi-exogenous shocks. But what are you thinking about vaccine distribution and your research?
Oh, thank you. I think there are several challenges, with respect to the vaccine rollout. Some of it is related to, even before the rollout associated with the manufacturing of the vaccines, and there are some challenges associated with raw materials constraints that delay scaling of production. So we're talking about syringes and vials not being available. And that's something that the Biden administration recently addressed. They were basically going with a 20% increase and making sure that they had more availability of the vaccines in each vial. There's also quality assurance challenges in manufacturing. The third point that I want to hit, which is really important here, is some of the inequities in vaccine distribution that we see today due to the digital divide between the haves and the have-nots. In terms of, we're not just talking about people in different socioeconomic classes, but also many elderly citizens who do not have access, for instance, to make those online appointments with the local health authorities. For instance, Austin Public Health is our local health authority that is in charge of a lot of the vaccine rollout. And I know from, firsthand experience that many of our senior citizens are having difficulty in accessing their website, and they're depending on their adult kids to be able to, make their appointments. So right there, in terms of technology, I think, a couple of things that we really would like to highlight is the role of electronic health record systems to be able to have these patient registries, right? So health systems can depend on electronic health records to leverage those patient registries and to schedule people for the first dose and even auto schedule for the second dose, right? And the second thing is, again, the role of mobile health technologies to do auto notification of for patients, especially in underserved communities. For instance, ZocDoc, one of the popular telehealth platforms, they've partnered with the city of Chicago to actually use the ZocDoc telehealth platform to reach out to minority communities to schedule their vaccination appointments. So again, there's a whole role of AI again in terms of how to make this process a lot more smoother. But I think I'm going to stop here due to our time constraints.
And Mark, do you have anything on the ground from Houston about vaccination, either related to your hospital or just what you're seeing in your city, that you wanted to share views?
Sure.
on
Yeah,
that?
I agree with everything that was just said. The fundamental challenge we have right now, and there's many challenges, don't get me wrong, but the fundamental is there's not enough vaccine. I mean, that's the number one constraint that is occurring right now. So I'll give you our experience. I mean, we've done 133,000 vaccinations as of yesterday. 95,000 of those are first patients. So next day or so, we'll pass 100,000 individuals vaccinated. And we get it into people's arms the week it comes. But we could be doing twice as much to 3 times as much each and every week. And we're only one of a few channels in Houston collaborating together, and we've not tapped all the other channels. And so we've done a collaborative plan across the Texas Medical Center institutions with the county, with the city, and looked at, okay, if we wanted to herd immunize the city of Houston, or the greater Houston area, what's that take? It's 7.1 million people. Kids aren't eligible yet. So it's really about 5.5 million eligible individuals, which actually, to get to herd immunity, since kids aren't eligible, and if they never became eligible, you actually need to vaccinate almost every adult. And when we look at that, that is basically about 52,000 shots a day that need to be administered in the greater Houston area for 6 months. And you'll get to herd immunity in 6 months. But we're getting first shots. Now that number I gave you of 52 is for both shots, but we're getting first shot supply of about 65,000 a week on average right now into the city. And so we need somewhere around 175,000 first shots alone coming in a week. So we're getting less than half of the supply to get there. So the biggest challenge is still that. Many other challenges, of course, in terms of scheduling. I completely wholeheartedly kind of reinforce those inequity issues, the digital divide issues, different uptake rates, different vaccine hesitancy and vaccine skepticism across different groups of people. Those are real dramatic, significant challenges. And we've probably even all seen the New York Times report. I will tell you, we're seeing the same thing in Houston. Even when you go target into a vulnerable zip code, you end up finding that you have disparities happen in that zip code because of the digital divide, because of different groups of people having different kinds of access. And so it is a real challenge that everybody's on the ground working on.
So I look at that as in part being part of the public health ecosystem or crisis. What do you see for the next 2 to 5 years? Do you have any hope you can give us about public health, or concerns that we just need to keep looking at even when this pandemic's passed? Anybody that wants to talk to us about the public health landscape in the next 5 years?
I mean, I think go ahead.
No, please go ahead, Pia.
Okay, well, I'll just speak generally and then you can speak more specifically. But just in general, our healthcare system obviously has a lot of problems. We spend in this country, over 18% of our GDP on healthcare, and we get worse outcomes than nations that spend a lot less. So we have a lot of changes that we need to make. And I think we're learning, but we're learning very slowly how to address those changes that need to be made. I mean, I think the Affordable Care Act was designed by an economist. I guess I'm biased, but he had some ideas about some of the changes that need to be made in order to improve healthcare delivery and healthcare outcomes. So I think there's so many problems in the healthcare systems that in the United States that I guess the good news there is that there's a lot we can do. So it's not like a problem that's insurmountable. There's so many things we can do to improve it. And hopefully the pandemic will speed those changes up and increase the willingness to undertake those changes.
Yeah, I think if there's one thing the pandemic has definitely shown us is that we have dramatically underinvested in public health. So whether you're talking at the federal level, the state level, the local county level, city level, we're not investing enough. We've not put in place, certainly from a pandemic preparedness standpoint, we've not put in place anywhere remotely near the kinds of investments that we could be putting in to prevent the situation we're in today. So, one thing I hope is that we see that significant investment, because I think it will pay significant dividends. I mean, if you look at actually the last century, the things that actually changed life expectancy the most were public health, right? It was potable water, and then it's vaccination programs. And, then you can get into things like antibiotics and other things after that. We've gotten a little complacent. We're arguing about whether vaccines are the right thing to do when they're clearly the right thing to do from a public health standpoint. And we got caught very flat-footed. And it's not just the US, it's the entire world got caught flat-footed because we're not investing in the public health infrastructure and really respecting infectious diseases like we know that millennia of people before us have had to respect.
And the one other thing I would like to add is just, there's going to be a greater focus on mental and behavioral health issues. I think telehealth is a great platform to address that. I can see that in some of my own research data, but there's going to be a significant greater focus on mental and behavioral health issues. And the last thing would be, I would say, use of more systems engineering type concepts and principles to improve the efficiency of our overall healthcare system, echoing what Dr. Boom said.
Yeah, I know here on college campuses and UT specifically, we care a lot about mental and behavioral health with our students, so much so that the individual colleges themselves now have mental health counseling resources embedded in each of the colleges. And UT is not alone in seeing a real increase in the needs and appointments and the severity of concerns that students have trying to go to college when their families have financial distress or health difficulties. And so it's a tough year, and I'm glad we've got more ways to reach people in this tough year. Does anyone want to try a political forecast? We have a fairly split, the Democrats have the tie-breaking vote in the Senate. What's your prediction of the likelihood of some sort of Medicare for all or a big expansion of public health availability in our current administration?
It's not going to be me, guys.
I'll jump in. First of all, Medicare for all is a horrible idea. Let me just start with that. It's not the solution to the issues. Biden has come out and said the answer, he said this all along in his campaign, the answer is to build on an infrastructure that's been in place now for 7 years since it actually got implemented, over a decade since it got passed. And like it or dislike it, I think it's hard to argue with the fact that we've seen significant decrease in uninsured rates everywhere that has gone forward with it. And once rates and things stabilized, it's actually been relatively stable the last few years. So, Medicare for all, I honestly, and you can tell my opinion on this, but it's mediocrity for all. At the end of the day, when you look at how healthcare is financed, you're going to basically upend the system. And people in Medicare are getting something they think is really good right now because everybody else is paying for it. And if you move everybody to Medicare, you don't have everybody else paying for it, and you're not going to get the same thing. That gets down to the questions of, value-based health and population health and investments in public health and alignment of incentives and all those kinds of things that can happen going forward. So I don't think we're going to see Medicare for all. I don't think that's what Biden said he wants to do. From what I've seen so far, most of his priorities are non-healthcare, and that's another thing to remember. And when he talks about his key priorities, you don't see healthcare access on there, in part because I think he's seen how, what a political landmine that is every time someone goes through it. And so he's talking about, many other things other than healthcare.
Okay, well, I wish we could ask even more questions, and I'm looking at the time, and so I'm going to wrap us up. Thank you, Mark and Indy and Pia, for all of your insights. I'm coming away optimistic that this urgency of innovation, that spirit can stay with us, not only in the healthcare industry, but elsewhere. And I hope you can all join us on February 11th for our next Business Outlook, where we will focus on technology and innovation. Thank you to all of you that tuned in, and hook 'em horns.